Hi guys, welcome everyone. So we're here today. I'm Dr. Richland, and we've had some questions about breast augmentation, and I'll be trying to answer those questions today. Breast augmentation is enlarging the breast through surgical means, most commonly with an implant, but another technique could be doing fat grafting and enlarging it with the patient's own tissue after liposuction. So using an implant, there's two types of implants, silicone or saline. That implant is gently inserted underneath the breast tissue to enlarge the breast and increase the volume of the breast. Patients who are looking to increase the size and volume or projection of their breast are all good candidates for breast augmentation. Of course, we want you to be in general good health with no medical comorbidities and have realistic expectations about the surgery and recovery processes. During your consultation, you'll first answer some basic questions about yourself, your surgical history and medical history, and then I'll come in and discuss with you your plans and goals for the surgery. I think that's the most important part of the consultation because that's my chance and your chance for us to get to know each other and for me to try and understand your reasons and goals and expectations for the surgery. After that, I'll do a quick physical examination, and then from there we'll look into hopefully scheduling a procedure and discussing any preoperative testing. There are hundreds, if not thousands, of different kinds of implants. The most common that I use are silicone implants. The other category is saline implants. The silicone implants have a silicone outer shell, and it's filled with silicone. The saline implants have a silicone outer shell, but it's filled with saline. So it's the material that makes up the inside of the implant that makes it different. There's also textured and non-textured implants, but most commonly I'm using silicone, round, smooth, non-textured implants. However, depending on patient preferences, we can deviate from that, and that's why I have a whole array of different implants. And additionally, if a patient's coming in for a revision or has a history of capsular contracture, there's different implants and different types that can help reduce the risk of that recurrence as well. So here's a silicone implant. You can see with the silicone outer shell and the inside silicone, and it looks and feels a lot more natural. This is actually a tissue expander, but it's the same principle as a saline implant. There's a silicone outer shell, and then it's going to be inflated with saline. There's three areas where breast augmentation incision can commonly be performed. The most common area is underneath the breast in the inframammary fold. That incision is very small. It's just about an inch and a half long incision, and it's hidden very well underneath the fold. The second most common area is above the areola. So the nice thing about that is it can be hidden in the junction, the natural junction between the pigmented areola skin and the lighter normal skin. And additionally, if the nipple itself needs to be lifted just a centimeter or two, at the same time we can do that lift as well. The third area where an incision can be made is all the way in the armpit. That's called an axillary incision. And then I can use an endoscopic technique to insert a small camera, and that allows me to place the implant without an incision directly on the breast.